We're here at HIMSS 2018 at the Voalte booth, and we're talking about communication. And we have a special guest, Candice Friestad. She's the Director of Clinical Informatics at Avera Health. Welcome, Candice.
Glad to be here. This has been a great opportunity, and there's so many people here and so many great ideas. It's been fun.
Excellent. So tell us, why did you choose the Voalte platform for your communication needs?
We ended up having lots of nurses that were telling us, I have a tool belt, I have a mobile phone, I have a pager, I have my own personal phone that I'm probably not supposed to have, and how am I supposed to know what I'm supposed to do with all of this? So consequently, after a fair amount of urging from all of them, we said, please do something. We started looking at what opportunities there might be out there, and really Voalte was our number one choice to allow us to use kind of a combination of either we purchased phones for our staff or BYOD, basically, that they could use their own personal phones. So we have kind of a combination of that. Currently, we are, Avera Health is 34 hospitals, and then a few long-term cares and quite a few clinics, 200. And so we also cover a wide span of area, 600 miles from one entity to another, and in 5 states. So we needed to figure out some sort of communication platform, not only for a particular facility, but in between facilities. So that really is what drove us to that direction from a smartphone perspective.
Interesting. So is there anything that surprised you about the platform, and what's been the user's reaction to implementing the Voalte platform?
Well, 2 surprises, probably good and bad. One is communication in the past has been, if I need to find out something about a patient, as a provider, I would call the floor and say, I need to get a hold of, or who's taking care of this person? I need to get a hold of this person. And they say, well, they're kind of busy with another patient, and it sometimes takes 30 some minutes just to talk to that same person. But now you can look quickly on the Voalte device, see what room or what patient, those things are both available on my smartphone, and then I can say who the nurse is, who the pharmacist is, who's the case manager, or social worker, or respiratory therapist, or physical therapist. Whoever I need to talk to, I can see who's affiliated with that particular patient and either text them or voice call them. So that was really the positive part. The one interesting thing is that we are so smartphone. The world is smartphone now. We're all Pavlovian into smartphones.
Yeah, we all use it every day.
Absolutely. And so one of the things that we would run into is if you answered a landline, you would say, hi, Candice Friestad, RN, or nurse practitioner, 3 East. It would be professionally answered. With the smartphone, some of the nurses were answering the phone and going, sup?
Hey, what's up? Not the
because
best,
that's
huh?
what they're used to. The other thing that we also ended up doing is a top 10 list for both our providers and our nurses that said, don't text me if you know I'm going to round. In other words, we're trying to deal with some of the alarm fatigue that ended up happening just because we were using smartphones and because everybody has used it since the time that they were 3 or 4 years old, it seems. They have this social mantra of a smartphone, and how do we best do that in a professional environment? It has been a journey.
It's amazing how habituated we become to the smartphone and other things, so that's interesting. It sounds like you've brought the whole care team there, which has impacted care in a good way. But you've also done some other integrations with other systems. Tell us about what you've done there and your experience in integrating with outside systems.
Okay. So we wanted to bring as many alarms, and part of this had to do with the Joint Commission in 2014 said we have to have an alarm fatigue seminar or policy or whatever. How are we going to handle that? Sure. So we got a lot of our bedside practitioners together and said what alarms mean the most, and then how can we all get it to that same phone. So what we do is we use ConnectAll for our middleware, and then we have multiple monitor systems. Draeger and Philips are 2 examples, and what we'll take those monitors that are assigned to that particular patient, and I'm a clinician here for a minute, but VTAC, VFib, asystole, SpO2 in our NICUs, those are automatically then delivered as an alert to the person's smartphone so they can deal with it, and with a critical noise, to be able to handle that particular alarm. We also integrate to our nurse call system, and we use Rollin 5 and Responder for that, and that allows us to not only, if the patient wants, say, water, we can direct that to the patient care tech and not really bother the nurse with it. But if they want to talk to a nurse, they can either press nurse or pain, and if the nurse, for example, goes, I really can't give them a pain pill right away, or I'm busy doing something else, they can talk directly on the smartphone to the pillow speaker to the patient and have a conversation. So the patient, from a satisfaction perspective, that was a huge win. And then we also integrate to our EMR. We have a Meditech EMR across Avera, and so we integrate all critical labs, highs and lows, that go directly to, again, the caregiver that's taking care of the patient. We also do 3 individual, for example, heparin level or an anticoagulant called INR. All of those levels go to the phone, and then we have sepsis protocols that we actually incorporated into our smartphone, so that we send all lactic acids and then allow for a repeat for the lactic acid. We've gotten to the point now where in our sepsis committee, which is multi-providers, nurses, pharmacists, where we'll come up with how can we make a dent in sepsis and consider it like an event, just like what you'd call code blue for, and we really operationalize the Voalte phones to be able to do that, to the point where Voalte is now a verb. So let's Voalte that, or can we Voalte that, and really, and these guys didn't make me say that, it has just turned into that.
It's just part of the culture of what's happened, because it seems really interesting. I'd never heard someone say that before, that by creating a unified communication platform, you're able to address alert fatigue in a more effective manner, because once it's across 10, they're like, well, we don't have alert fatigue, but we don't have alert fatigue, but then when you get a 10, it's like, oh, across all of them, yeah, we're making them all suffer. So I think that's pretty interesting. What advice would you have for someone who's just starting to unify their communication systems? What would you suggest to them?
Well, sometimes implementation of this is not exactly for the faint of heart, and now I'm going to take off my clinician hat and put my networking hat on. So consequently, you must have a robust wireless system. We started out with 802.11g and N, and that was, I was young and foolish at that point, and we really had to move into more dedicated wireless. We ended up having to look at what kind of SIP servers we had in our PBX systems. We ended up going with a separate SSID, because we had really given our public Wi-Fi the ability to patients to bring in iPads or their own phones or their own tablets. We needed to have some sort of conduit that would work, so we weren't just competing with all that traffic. So we have a dedicated SSID that is specific to the Voalte professional traffic that we're having there. So that's a beginning piece. The other piece is to look at workflow. We did this with the design and the input of all the bedside practitioners. If you take it from a top-down approach, from an IT top-down approach, it's very difficult to do that. One example that I heard of a colleague of mine is that IT decided that they would alarm from their nurse call system every 5 seconds, which, needless to say, can make an implementation, well, in this case, the nurses said they just throwed the phones and said, we're not doing that.
Yeah, forget about it.
And from someone that hasn't lived it, it makes perfect sense. And for those people that are actually at the bedside, they're the ones that really have to be the how do we handle this and what makes the most sense. So we have a lot of, one use case scenario that I talked about yesterday was that came from we have a large orthopedic service, and we have athletic trainers, 14 of them actually, that get deployed to football, high school and college football, and when they saw how we were using the Voalte phone, they said, well, can we put that on our own personal devices, because one of the things Voalte also does is secure pictures, so that while they were in the field, we have an on-call orthotraumatologist that's always available, but they could be wherever they were, scattered within the Avera Health footprint, could either take a picture or text or call directly in the event that they had a case, so that really that allows that provider and even surgery to be ready if necessary.
Well, and a much better workflow, and obviously more secure than what they were probably doing on their regular
Exactly, yes, and that was the other thing, is that I think texting was happening on our smartphones anyway with PHI, and in this case it really is from the C-suite on down. If you're going to text PHI, it must be in the Voalte platform.
Just Voalte.
Yes, just Voalte.
Excellent. Thanks so much for sharing your insights, Candice, and your experience at Avera Health. And thanks for all watching live. We really appreciate all your support. If you want to see more great healthcare IT content, check it out at healthcarescene.com.